Sorry about that. My husband called and it stopped everything, so I do apologize. I think where I was at is what brought me to Dr. Lopez and ALO Bariatric. I did find a few things through the internet on Facebook, but I could not find anything negative to say. Um, I was able to get logged into through my research. I applied to a couple different doctors. I did get approved for the DS with Dr. Lopez, and he was a doctor that was going to be able to do my gallbladder and get that removed at the same time for an extra $1,500. And I didn't want to recover from another surgery. Unfortunately, in September and October, I had kidney stones, and they went in to remove the kidney stone in the end of September, and they missed it. They thought they couldn't find it. So, unfortunately, I was still having issues. And when they called my husband to let him know that uh, they weren't able to find it, they asked if they could put a stent in. And my husband told him, no, she's had issues with stents, so please don't do that. If you can't find it, maybe she had passed it. Well, it turns out that they had pushed it back up into my kidney. Somehow they had missed it. So when I went back in for my follow up, um, I was still having issues, a lot of pain, a lot of blood, things like that. So I went and did more x rays, another CT scan with contrast, and they were able to see it. And so 2 weeks after the first surgery, I went back in for another surgery. And this time they were able to successfully remove it. And one of the questions that I asked on the ALO Facebook page was, this has happened, and I knew that I wanted to have the surgery as soon as possible, preferably before the end of the year. And the the great thing is the anesthesiologist. She got on and she posted, I would recommend, and here I'm going to tear up because I was just thankful that she got on and she mentioned, I would recommend that you wait 3 months before you have another surgery. You need to heal fully before you go under again. This is a big surgery. And because she went on there and said that, I hadn't paid anything yet. I hadn't scheduled my surgery. I was still, watching and trying to make the best decision because it's scary going through all of that. So I'm not sure why the lights keep changing on there. So I do apologize. I guess it is getting a little bit late. Uh, with her saying that, I was also devastated of, look, I've had to have these two surgeries. Now I'm going to have to wait for this other one. And I was just so frustrated. When I went back to have the second surgery, I asked the anesthesiologist that was doing that surgery, letting him know that I wanted to do the weight loss surgery and how long should I wait. And he's like, oh, you'll be fine. No big deal. Do it. The kidney stone doctor, the urologist, he said the same thing. Oh, you'll be fine. Anytime I went into, because I was having issues, Instacare or whatever, I mentioned that that's what I wanted to do. And my primary care doctor knew that that's what I wanted to do. And they were all on board. Yes, yes, you need to have that. The sooner you can have the weight loss surgery, the better your health is going to be. That's what's causing you all these issues. And so I just felt 3 more months. What, I don't want to do that. But again, hearing the anesthesiologist get on there and recommend waiting that 3 months, it made me feel better because I knew that this was the right place. Uh, they weren't in it just to make money. If they were one of the other doctors, they would, come on, let's do it. But I felt that care. She wanted to make sure that I was going to be okay and wanted to make sure that I was in the best position possible to undergo the surgery. And then I also seen other patients that had had the surgery post, most of them are sleeve patients, but they would post concerns or questions, and I just seen Dr. Lopez on there responding right away. And anything that seemed a little bit concerning, he would say, I'm going to message you. It's important that we talk. And when I did have the surgery with Dr. Lopez, I had a concern, and he immediately got on there. Here's my phone number. Call me. So I was able to talk to him over the phone. I have his cell phone number, so if there's an emergency, I wouldn't have got that with any of the doctors here. You have to go through the big, leave a message with the receptionist or the answering service, and then maybe in a couple days you might get a phone call back. But he wanted to make sure that he got a full understanding of what I was going through, answer any of my questions, and then in that case, he had me go to the emergency room just to be checked out, and I was checked out, and they couldn't find anything wrong at that time. So, there was nothing wrong with the surgery. And so it was better to be safe than sorry. And, it's just, I just take a long time to heal, is what it comes down to. But so that was one of the reasons, again, that I chose Dr. Lopez, and his office. It was great. I did try to record when I was at just after surgery. And unfortunately, you're in Mexico, and I didn't have the great internet service on my phone. And so it didn't, I tried to post it, but it wouldn't post, and I lost the video, unfortunately. But I was trying to record the recovery boutique and all of that. And that's something that I can go into on another video. The first video today was a little long, and then here's another, some 7 minutes. So um, trying to think of if there's anything else that energy wise, I am feeling so much better. I have more energy. It's starting to come back. One of the things that I did do, unfortunately, is my husband was very supportive that I have the surgery. He was a little nervous me going to Mexico, and I previous surgeries, again, I mentioned I had C-section, lots of different surgeries before, so all three of my children were C-section. He wasn't very supportive during those C-sections and recovery. After my first daughter was born, unfortunately, we were moving and packing up at 2 weeks after a C-section, so I had a lot of scar tissue from that, not resting in recovery. So this time going to Mexico, I wanted to do everything on my own. I was planning to save money, and I was going to go and stay by myself, and I would save on everything going by myself. Well, he was a little nervous about that, and then I had to come out and tell him, well, I don't want to have to worry about you. While I'm there, I need to be there, and I need to be recovering and worrying about me. And so it was decided that hurt his feelings, and which I felt bad about. But he stayed home with the girls, and he didn't want me to go by myself. He said, I'll feel better if your sister goes with you. So my sister and I both went, and it was just great to be able to get away with her. And both of our first time in Mexico, neither of us speak Spanish, but we got along, and it was great. No issues with anything. All of the people that we worked with, even at the hotel, was fantastic. When I came home, my husband was just great. Didn't want me to overdo it, tell me that I couldn't clean, that I just had to rest and recover, rest and recover. And that I tried to do that as much as I possibly could. And then, how when you're resting, you see everything that needs to be done. You feel bad that you're resting when the house needs to be cleaned or cooking needs to be done. So I tried to do that. I tried to go back to work probably at week 5, because that's usually the average. It's a little bit longer than the average time. And I reached down and I pulled an incision, internal incision. I made it there maybe 3 hours for the day, and I realized that my boss told me I was supposed to be back a certain day, and when I went in, I wasn't scheduled to be back till the next day. So I just, I was tired, and I just like, I'm gonna go home. Since I'm not scheduled today, it's like, okay, we'll see you tomorrow. But I had just pulled that, and I wasn't able to go back for a couple more weeks. Well, after I started, went back to work, I think I was off for 8 weeks total, and things were going good. I do like my job, and I do like working, but unfortunately I did something again when my daughter was sick, and I was laying in bed, and I tried to get up, and I got up the wrong way, that I tore again. And so anytime I would move the wrong way, I kept re-tearing that muscle, and this is the worst thing. If you've had stomach surgeries, when you sneeze, that hurts, but this was, sneeze, if I take my vitamins and like get stuck or dry heave, or I try to roll over in bed, I got up the wrong way, and it wasn't always, I could get up the same way 10 times, and 2 out of those 10 times it would tear, and it just felt, I swearing up a storm, because it, like stubbing your toe, you can't control that. Quick swear words, things like that. Well, I finally feeling so much better now. It's starting to heal. We wanted to make sure that it wasn't a hernia. I was able to get some really strong anti-inflammatories, and taking it at night, and it seemed to really help, and as well as resting. I'm still not trying to do lots of heavy lifting or cleaning, but it's been a good recovery. Just slow. My weight loss has been a little bit slower than a lot of other people that post, but I'm very happy with the results so far. I'm very happy to see the scale moving through the stalls, through trying the head games, my head hunger, finding the reasons that I want to eat. I'm bored, emotional, I'm sad or lonely. I don't know what it is. And those are things that I'll continue to talk about. I think I've learned through watching videos that it's very therapeutic to talk feelings out, and then kind of go back and see how you're feeling. And this is again for me to feel more accountable and learn a little bit more about myself through this journey. And I'm just not sure how often I'll post. Probably be in the car so that there's no interruptions unless somebody calls and hangs up on me, or when I'm waiting to pick up my daughter from school, I might post something, but we'll see how it goes. And if you are watching this and you have any questions, I'd love to answer those questions for you, help you feel a little bit more comfortable about your decision to do the DS, or if you're trying to decide on a doctor, things like that. Through the different websites, I've been able to, in the support groups on Facebook, I've been able to give a lot of feedback and support, and referred a lot of people over to Dr. Lopez, and I don't get anything for that, but it's just so good to know that there's another choice out there that is going to give you some safe, good results, and you don't have to go to the one doctor everybody tells you have to go to if you're looking for DS. And that's one of the reasons that one price. But I also am a little stubborn, and when somebody tells me to do something, I'm going to find an alternative way around that. There are, some good choices out there. And, well, thank you for watching, if you did watch, and for staying all this time. And again, I'd love to hear any of your feedback, or questions or anything else. Well, you take care. Bye.